My name is Dr. Carolyn Watson. I am a cataract, refractive, and cornea fellow at the Eye Institute of West Florida. This is a surgical video series showcasing some of the cases that we do and that I've done over the past couple months in my fellowship. This one's titled Keeping Your Cool During Unexpected Complications. This is a standard cataract surgery, and we use a diamond blade. We have paired incisions about 70 degrees apart. The anterior shoulders of the diamond blade are 1.4 millimeters, and the posterior shoulders are 1.6 millimeters. I am doing just a regular viscoelastic injection, and we use the MST microcapsulorhexis forceps to do our capsulorhexis. I really love this instrument. It's so easy to use, and it's just such a really beautiful instrument, and it gives you such great control over the tissue. We try to do a 3-grab capsulorhexis, and here I'm just kind of staying along that pupil margin since the patient's not very dilated, and then going ahead and extending it past my start point anyway to get it a little bit bigger. Next, I'm going to hydrodissect, hydrodelineate, and rotate all in one nice movement, and go ahead and use my bimanual irrigating chopper and 20-gauge phaco needle that is compatible with the Stellaris Elite by Bausch & Lomb. Here I'm just doing a divide and conquer technique. 3 or 4 passes, and spin and crack the nucleus at the same time. This cataract's pretty cooperative and pretty easy to crack, as you can see there. Just trying to get those edges to make my life easier. And then we usually go about a 45-degree angle into the next segment, track all the way down about 3 grooves and crack. And I go ahead and switch to phaco power, and all of a sudden the entire chamber collapses on me. And my instinct is to be very still and not take the instruments out of the eye. I don't want to cause any more damage than already is occurring, and so I very carefully decide to take out my phaco needle to free up my right hand so that I can stabilize the anterior chamber with some viscoelastic and reform that section so we can get everything back into place, and so that I can actually get my irrigating chopper out of there as well to figure out what's going on. So I go ahead and reform the anterior chamber very carefully. I didn't want to pull out my irrigating chopper because it does have that hook on the edge, and it could definitely have damaged the iris or caused a tear in the anterior capsule. Come to find out, the spike had come out of the bottle when it was raised, switching to phaco, switching to segmentation, and we had to recalibrate the whole machine and get going again. And so I just sort of picked up where I left off. There was no damage to the cornea, there was no damage to the bag or the iris, thankfully, and I just go ahead and get out that first segment, reach over and get the second piece in the AC. Pupil is obviously a little bit small, which is fine, and then go ahead and chop the other hemi, get that going. And, this patient ended up doing well, and we go in with our diamond dusted INA tip. And I really like this instrument because it does have that, almost serrated rough edge to help you get off some of those stubborn cortical pieces that don't come as easily as you would like. And here's a good example of the big shells that we tend to see with hydrodelineation, and sometimes they can be pretty stubborn and thick. This one is actually not too bad. So just pretty carefully going around and getting it to move for me, and luckily it just kind of comes out without much effort. And then we are going to just getting those final pieces of Cortex out and polishing that capsule. That's what's so nice about this INA tip that we use. And we are going to go ahead and inject a Bausch & Lomb Acryos lens, a monofocal lens. We do use this lens quite a bit. We really like it. It behaves really well in the eye and is very stable and does well long term. So this is kind of our go-to monofocal lens for our patients. And luckily, there were no complications for this patient. He did really well. So thanks for watching.